Good evening students. So today we are going to study about our intense chapter of biology, which is a very interesting one. And in society, this chapter is related to some taboo also. Okay. So this chapter is your reproductive health. This chapter tells you about what is the health related to your reproduction system. Okay. The health which you require in your reproductive system for well-being of your reproduction system. Okay. This chapter is present in 12th class because give the teenagers information about puberty, about sex-related problems, about that sex-related abuse, crimes, okay, and different sex-related issues has been studied under this chapter. Okay. Now this chapter is divided into I divide this chapter into two parts. First one is your that population explosion and that birth control, okay, and second one is your okay, infertility. So what is reproductive health? Okay, World Health Organization defines reproductive health as a total well-being in all aspects of reproduction, physical, emotional, behavior or social. See, in that chapter, human health and disease study, that health is the state of an organism in which he or she is mentally, socially and physically fit. Same thing we apply in reproductive health also. Okay, reproductive health means the person should be reproductively healthy. Either it is physical, emotional or your behavioral or social. Okay, physical means that organs of reproductive system means that external genitalia should be physically active, then the person is reproductively healthy. Emotionally means that emotional balance during that intercourse and coitus should be essential between the male and female couple. Okay, next behavior. The behavior between both the couples should be equal and should be stable. Then you are reproductively healthy. Okay, next social. Okay, social well-being. Okay, what you are doing socially, it will be also accommodated under this thing. Okay. Now, reproductive health problems and strategies. Okay, India initiated reproductive health program family planning in 1951. India is the first country in the world who started this family planning program all over the world. India is the first country, again I am saying India is the first country who started family planning program in 1951. Wider reproduction related areas are in operation under the reproductive and child healthcare program. Okay, wider areas means that full narrow branching area you are covered under this study. Okay, all the aspects, all the things which is related to the reproduction, all the areas which have been that poor reproductive status has been come under this thing. Okay, just like some families, some religion there is having that prestigious value that you have to give birth to 8 child, 4 child, 5 child. To control that thing, government issue a plan which is called family planning program, which started in 1951 by Indian government. Okay. So such programs deal the following. Then that program, what the program deals with, what the schemes come under that program. We are going according to NCERT. Okay, which terms, which plans come under, which strategies come under that plan. Now we are going to see that. First, giving awareness about reproduction related aspect for certain reproductive health in society. You have to give a special advice, special knowledge to different communities of your society, to tell about that sex is not taboo, intercourse is not taboo, coitus is not taboo. Okay, you will discuss this thing fully. You can discuss this thing openly in market with your family members, with your peer ones. Okay. Second, educate people about birth control, care of pregnant mother, postnatal care of mother and child, importance of breastfeeding, equal opportunity for male and female child. Okay, birth control means, see, in your family who having 5 to 6 child. Okay, 5 to 6 child. The load on that family increases as the number of children increases. 5 different children are there. Okay, you have to feed 5 children. Then that accommodation, all the things increases at that family. Okay, so due to that reason, birth control should be important in a family planning program. Second, care of pregnant mother. Okay, if you do not give care to a pregnant mother, how can a good child, healthy infant can take birth? Okay, next, postnatal care of mother and child. After giving the birth, you should do a proper care of the mother and the newborn child. Feed them proper food, feed them nutritious food, balanced diet. Okay, on that first 2 months or first 2 years should be on breastfeeding. Up to 1 month, that child should be on breastfeeding only. Okay, no outside milk, only mother milk should be given to that children. Okay, next, that is your importance of breastfeeding that I told now. Equal opportunity for male and female child. See, this is a very serious problem in India, especially in states like Haryana. Okay, in this state, what the people do in mainly in rural areas of Haryana, in the villages of Haryana, if in some family the child girl take birth, they will kill them, and that thing is called female feticide. Okay, or other than that, if sometime what happen, see, first child is girl. Okay, so that family, the parents think we want boy child, so in the second time we will get boy. But if unluckily that girl, the second one is also girl, then again they will take a chance to get third child, which can be a boy and can be a girl. Okay, so according to that, you are increasing the population in a family to getting a boy child. Okay, but this is not good for an particular area, because due to that population explosion, increasing the population having. Okay, so there we have to give equal opportunity, equal value to girl or boy child. Okay, next, awareness of problem due to the population explosion, social evils like sex abuse and sex related crimes. Okay, that good touch, bad touch in public to girls, rape cases, all these things, these knowledge to be provided to every children, not girl, boy also. Ki where are you touching, who you are touching, how to deal with the situation. Okay, do not over excite yourself in public. Do not do bad things. Okay, so these all things are should be educated in the population to that. In schools, in colleges, all these things should be studied in colleges and schools. Okay, next. Now sex education. Okay, aim and need of sex education in school. First, to provide right information about sex related aspects to help to avoid sex related myth and misconceptions. See, sex is not a normal thing now. Okay, means it is a normal thing now. Previously, it is not a normal thing. Okay, previously, when sex word come in the mind of a person, it always a dirty thing. Okay, but sometimes what happened in real life, in now life, that thing is going down. Okay, sex related things has been taught in the school, that taboo has been deleting from the mind of the society. Okay, so that's why the sex related problems, sex related aspects to be teaches inside the schools, colleges. Okay, second, to give proper information about reproductive organs, adolescence and related changes, safe and hygienic sexual practices, sexually transmitted diseases, AIDS, etc. Okay, if your school do not giving you proper information about sex, coitus or intercourse, then it is not good for your mental and that sexual life after some years. Okay, because of this thing, that safe and hygienic sex means doing a sex in better way. Okay, using contraceptive methods, avoiding STDs. Okay, so these all things should be taught in school and colleges, and that's why this chapter is present inside your NCERT. The basic need of this chapter in NCERT to give information, to give knowledge about sex related problems in adolescence. Okay, so next is your population explosion and birth control. Okay, how will you control the birth in a particular area, in a particular region, in a particular city, state, country. Okay, so there is some statistics. Okay, statistic values are here. Basically, this chapter is related to some population control or all these things, statistical values. Okay, so first statistical value is that the world population, which was around 2 billion in 900, rocks to about 6 billion by 2000 and 7.2 billion in 2011. Okay, the population around that 91900 is your 2 billion. Okay, now in 2000 this will become 6 billion. From 2 billion it becomes 6 billion. Okay, and now in 2011 it is 7.2 billion. As you see here, from 2 to 6 it is very high. Okay, but from 6 to 7.2 it is not that much high. Okay, the reason is that knowledge about science, knowledge about growth, knowledge about population growth. Okay, second, a similar trend was observed in India. Now we talk about India. Our population, which was appropriate 350 million at the time of our independence, reaches close to the billion mark of 2000 and crosses 1.2 billion in May 2011. Okay, see, during that 350 million population is present in India during the time of independence. Okay, but till 2011, the population has become 1.2 billion. Okay, that much high happen in India. Okay. So, a rapid decline in death rate, maternal mortality rate and infant mortality rate, as well as increase in the number of people in reproductive age are probable reasons. These are the reasons which are going to study further in this slide. Okay. Through our reproductive child health programs, we could bring down the population growth rate. It was marginal. Okay. We are taking the program. We are seeing the program. We are making that program successful. But still, that is not too much. Okay, that is not sufficient for us to take all the things properly. Okay, that's why it is written it was only marginal. Okay, next, such an alarming growth rate could lead to absolute scarcity of even the basic requirements: food, shelter, clothing, in spite of significant progress made in those areas. Therefore, the government was forced to take up serious measures to check this population growth rate. Okay, see. If we talk about a particular area, okay, in a particular area, if there is many people and resources is less, after some time that resources get exhausted, okay, that resources get over, due to which what happened, that ecosystem, that population start to decline. Okay, initially it will grow rapidly when that resource are present in abundance, but after some time when the resource getting to exhausted, then there is death of that species in that ecosystem. Okay, so it is not good to become overpopulated. Now next, reason for population explosion. Now what are the reasons of this population explosion? First, developing health provinces. See, these points you will think that some points are so illogical, but if a country having less resources, limited resources, and if that country have overpopulated, the population become more than the area of the land, then it will alarming condition to that country. Soon that country will be that depopulated, or the population will be the death rate should be increased after some time. Initially you have more birth rate, but after some time that death rate increase. Okay, so the first point is your developing health provinces. Okay, developing health provinces means that more hospital. More the hospital, more you are going to hospital. Okay, you become more healthy, your reproductive life become healthy, your reproductive health become healthy, you will reproduce more. Okay, and I am not talking about a single person, I am talking about full population of a country. Okay, second, an engagement in technology. Okay, modern technology in medical institutes are using day by day, which increasing the health of the human. Okay, but due to that modern technology, population is also increasing. Okay, death rate going down and that birth rate going high. Due to that high birth rate increasing, this population explosion occur. And the reason is that's your advanced technology in medicine. Okay. Next, comparatively superior lifestyle have explosion impact on the growth of the population. See, the healthy you eat, the healthy you are, and the healthy your reproductive health is. Okay, so that's why the person who has healthy food, he become healthy and he will reproduce more. So again, the population get explodes. Okay, then descending mortality rate. Okay, your mortality rate means death rate. Okay, death rate going down, automatically the population will explode. Death rate is less, birth rate is more. Then automatically the population of that area, that country explode very fastly. Okay, there should be a balance between death rate and your birth rate. If this balance goes up down, then automatically population explosion or other thing will happen in that ecosystem or in that country. Okay, next, decreasing maternal mortality rate. Okay, descending infant mortality rate. Okay, and last one is your spike in the number of individual or reproductive age. The more reproductive age people, the more reproduction will happen. Okay, that's why in a population which having equal amount of child, equal amount of adult and equal amount of old age people, it is the best population because it is having the stability. Okay, all three things come with a stability. All in equal number make that population stable. Okay, if your old people is more, then death is more. Okay, if young people is more, then reproduction status, reproduction practices is more. Okay, that again increases the rise in the population in particular country, particular area. Okay, now next one is consequences of population explosion. Now what will happen if population of a country, of an area explode? So first one is your unemployment. The more the people in a particular area, you see just like that, the companies is less in a particular area, but people are more. Now where that remaining people will go? They become unemployment. The company will give the job, and the one who do not get the job, they become unemployment. Okay, so the more the population, more the unemployment. Both are simultaneously increases in a country which does not control their birth. Okay, second, poverty. Okay, employment, no employment is there, then automatically poverty. You know, half of India population is below poverty line. You saw the movie Shivaji the Boss, Rajnikant. Okay, in this movie tell about that thing. That 10% people in India are richer and they becoming richer, and other than they are going that down below the that poverty line. Okay, so automatically when people become unemployed, automatically the poverty increase in a country. Okay, next, high infant mortality rate and child mortality rate. Okay, that high infant mortality rate and child mortality rate. Okay, more that population that do not get the food, okay, they automatically die. The child will automatically die. Okay, next is your increased crime rate. The person who is unemployed, they find the different ways to get money, and the one way is your crime. Okay, they will steal the things, they will do the robbery, they will kill the peoples for the money, for other things. Okay, so that why overpopulation causes increased crime rate. Next is disturbed social fabric. Okay, the society it become unstable due to overpopulation. Okay, different type of crimes, sex related crimes, rapes will happen due to which that social fabric will be disturbed. Okay, next one is burden on natural resources. The more the people, the more the human in the population, the more they use natural resources like water, petroleum, diesel, natural gas. All these are natural resources. Water is enough. Okay, water is enough. For now, water is enough. But what about non-renewable resources? Petroleum, natural gas, diesel. These things one day will be exhausted from the earth. And more the people on that particular country, more the use of these things, non-renewable resources. One day these resources will exhausted from that country. Okay. Next one is your deforestation. Okay. Now when the population increases, you want to live somewhere. You want a house. Okay. Now automatically you go and cut the forest. Okay. You know what? Human is a very greedy creature of earth. Okay. It will create its own house, but it will destroy other animal house on earth. Okay, so that overpopulation causes deforestation. More the population, more you need house infrastructure, then you start to cut down forest land. and make that land under your capture and make your cement forest there. Okay. Next, increased waste generation. More the human, more the population, automatically waste generation is more. Okay. You eat, you will throw that remaining of that eatable items, you will wash the cloth, you will dispose that and that dirty water, automatically waste number increases in an ecosystem. Okay. So these all are the pollution. Okay. Pollution is the main consequences of overpopulation. Okay. More people, more they have in car, bikes, then more pollution will occur in the ecosystem. More greenhouse effect, more global warming. The reason of global warming and greenhouse effect nowadays is because of overpopulation. Countries like China and India exhaustly, more powerfully, more over exploitly using natural resources like petroleum, diesel, natural gas, which is coming out from the vehicles, and they are making all in the Antarctica, which causes global warming. Okay, so all these are the consequences of population explosion. Okay, now next, control measures. Okay, what are the control measures to that decrease that overpopulation, or how to control that overpopulation? First, motivate smaller family by using contraceptive methods. Okay, means small family means 1, 2 child sufficient, no more than. Okay, then it is called a good family, a small family, a healthy family. Okay, you do not have the load on the family, and simultaneously you do not providing any load on natural resources also. Okay, next, aware people about a slogan, हम दो हमारे दो, B2 or R2. Okay, V2 or R2, हम दो हमारे दो means male, female और उनके दो बच्चे. Okay, next, many couples have adopted a new scheme that is one child norm, means one child is sufficient. We do not want 2 child also. Okay, these things control the population. Okay, next, statutory rising of marriageable age of female 18 year and male 21 year. Okay, means that marriage difference. Okay, this will also decreases the chance of overpopulation in the country. Okay. Now next is your contraceptive methods. Different contraceptive methods which are dealing with in this chapter. How to control the population, that thing is controlled by different contraceptive methods. So first we have to study what is the property of an ideal contraceptive method. First, it should be user friendly. Okay, that person who using that contraceptive does not cause any allergic reaction, any disease, any other phenomena inside the body of that person. Second, easily available. It should be available everywhere. It should be easily available. It should be available in any shop, in any market, at low price. Okay. Third, effective. It should be effective. Okay. Not just like that you are using that thing and another day your female partner become pregnant. Okay, so it should be effective that much that it will reduce the chance of pregnancy. Okay, next is reversible. The major property of an contraceptive should be irreversible, because some things will do irreversible effect and it will damage the reproductive tract of a human. Okay, next, not or least side effect. Okay, it should do not have any side effect, or if having, it is very less. Okay, next, should not interfere with sexual drive, desire and sexual act. It should not go interfere with the sexual drive. Okay, during that coitus, during that intercourse, the excitement which is present between the couple should not be interfered. Okay, so these all are the properties of an ideal contraceptive. Okay, so these are the contraceptive which we are going to study in this chapter: natural, traditional method, barrier, intrauterine devices, oral contraceptives, injectable, surgical, sterilization or surgical methods. Okay, so natural, traditional method, avoiding chance of ovum and sperm meeting. Okay, natural traditional method का मतलब होता है, the meaning of natural traditional method is to avoiding the meeting of sperm and ovum naturally, not using any chemical, not using any machinery, not using anything, naturally by the process of your body. So in this we have 3: periodic abstinence, coitus interruptus, lactational amenorrhea. Okay, so periodic abstinence means avoid sex during the peak period of menstrual cycle. Peak period means at the period where your ovulation takes place. Okay, ovulation वाले period के time पे sex ना हो तो that type of thing makes your natural contraceptive methods. Okay, avoid coitus for day 10 to 17 of a menstrual cycle. That is the fertile period. At that time, ovum is ready to get fertilized with sperm. Okay, to avoid at that period coitus, then automatically no pregnancy will happen. Okay, next coitus interruptus or withdrawal. Okay, withdrawal the penis during ejaculation. When ejaculation, that insemination is happening, eject your penis. Okay, automatically that semen does not go inside the female reproductive tract, no pregnancy will happen. Okay, so withdrawal penis from the vagina just before the ejaculation to avoid insemination. Lactational amenorrhea. It is the absence of menstrual cycle and ovulation due to intense lactation after the parturition. Fully breastfeeding increases lactation. This method has been preventing conception. This is effective up to the 6 months following parturition. Okay, this method is very means the we can see the profitable rate in these three methods which are in the highest. Basically, that natural or traditional method are not successful. They are not successful contraceptive methods. But when we talk about these three, this one is little bit successful. For 6 months it is successful. Okay, in 6 months that thing has been avoided. During that lactation period, see, I will tell you one concept about this. Your anterior pituitary gland. Okay, now this gland is secreting one hormone which is called GnRH. Okay, this GnRH do what? It will help in secretion of FSH and LH. Okay, GnRH coming from your hypothalamus, okay, and acting on your anterior pituitary gland, and from that GnRH secreting that FSH and your LH. Okay, now FSH and LH will act on your ovaries and reproductive system. But you know what? When a mother is prolactin, means it is having one lactation period. It secretes one hormone at that time which is called prolactin. Okay, and this prolactin is the inhibitor of FSH and LH. Okay, means more the prolactin in the body, FSH and LH level goes down, and due to which your progesterone and estrogen level goes down. Okay, that's how you can avoid pregnancy. Okay, pregnancy hormone is less inside your body, automatically the pregnancy get destroyed or not happening inside your body. Okay, next method is your barrier method. Okay, it is the most successful method, very successful. To prevent physical meeting of sperm and ovum, example condom, diaphragm, cervical cap, and wand. Okay, these all are barrier methods. Okay, so first we have condoms. Okay, made up of rubber or latex. Okay, it is a type of a barrier which make a barrier between the meeting of your sperm and ovum. Ovum and sperm does not get mated to each other by the help of these physical barriers. Okay, condoms for male are covered on penis. Okay, the penis, the external genitalia of male is covered by condom in males. Okay, and condom for females cover the vaginal and cervix. Okay, जो cervix होती है और vagina होती है, it will covered by condom in female. Okay, next, condoms are used just before coitus. They prevent the entry of semen into the female reproductive tract. Okay, the main function of this thing is to stop the entrance of sperm inside the female reproductive tract. Okay, Nirod, popular condom for male. Okay, it is in Nirod, it is in government issued condom which you get freely in government dispensaries and government hospital. Okay, popular condom for male, this is your Nirod. Okay, next, they prevent physical meeting of sperm, ovum, example condom, diaphragm, cervical cap, and wand. Condom, why condoms are very popular? The reason behind that condom is used very popularly, very commonly as a contraceptive method The first, it protects the user from STD and AIDS. That is the main reason of using condom to prevent pregnancy, to take that contraceptive measure, because it avoid AIDS. Okay, HIV AIDS is not going to happen if you wear condom during the coitus or intercourse. Okay, it is disposable. One use, then throw. Okay, means once you use that thing, then throw it. Do not store. Okay, throw it in dustbin anywhere you want. Okay, it can be self-inserted and thereby given privacy to the user. Okay, no one going to make to wear this thing to you. You own have to wear this thing. Okay, so your privacy does not get interfered. Okay, then diaphragm, cervical cap and bolts. Okay, made up of rubber and are inserted into female reproductive tract to cover the cervix during the coitus. Okay, these are also made up of rubber. Okay, diaphragm, cervix cap and bolt, these things. These are cap-like structure. टोपी जैसा structure होता है. Okay, small cup, cap-like structure. They are made up of rubber. They are also placed inside the female reproductive tract. Okay, it will place inside the cervix to stop the meeting of sperm and ovum. Okay, some person can also use spermicidal cream and apply on these physical barriers to increase the chance to do not get pregnant or do not get fertilization of egg and sperm. Okay, next is your contraceptive methods. Okay, contraceptive method, that is your intrauterine device, IUD. Okay, these are inserted by doctor. That's, you have to go to doctor. You cannot implant this thing automatically inside your body by yourself. You have to go to a professional doctor or a nurse to insert this thing. Okay, or nurse in the uterus through vagina. They insert phagocytosis. They increases the phagocytosis of sperm. IUDs are ideal method to delay pregnancy or space the child. Okay, space child means if you first child is in after the marriage, after 2 years of marriage you get the first child. Now you want the second child, but you want that child after 4 years. Then the female can wear IUD and they can do coitus, but they do not get pregnant. Okay, if they want to become pregnant women, then they remove that thing and they can easily get pregnant. Okay, so types of IUD in market is your non-medicated IUD, copper releasing IUD, hormone releasing IUD. Okay, so this is your non-medicated IUD. They retard sperm motility, also have spermaticidal effect. Example, lippy loops. Okay, lippy loops is an example of your non-medicated IUDs. This is your lippy loop. Okay, it having loop-like structure, that's why it is called lippy loops. Okay, second one is your copper releasing IUD. Copper ion suppressing the motility and fertilizing capacity of sperm. Example, CU7 and multilot 375. Okay, next, hormonal releasing IUD. These make the uterus unsuitable for implantation and the cervix hostile to the sperm. Example, progesterone and LNG20. These all are hormone releasing IUD, and the main hormone which they release is your progesterone. Okay, now see how these IUD act. Okay, IUD. Now you place that thing. Now this thing release hormone like progesterone. Progesterone number increases. Concentration of progesterone increases. So it will send negative feedback to your GnRH. Okay, when the number of progesterone, concentration of progesterone increases inside the body of female, it will send a negative feedback to GnRH. Okay, to your hypothalamus, to your pituitary, anterior pituitary. Now that GnRH number decreases. Okay, because of this increase in the progesterone by these IUDs, that number of GnRH decrease. Automatically your two hormones FSH, follicular stimulating hormone, and LH, utilizing hormone, these number also decrease. And when these two things decreases, in automatically your progesterone and estrogen number inside your body is decreased, and that's why your endometrium is not become suitable for implantation. See one thing more that important. This progesterone which is increasing, it is not your own body progesterone. It is an artificial progesterone. Okay, artificial progesterone which is coming out from these things. Okay, these IUDs releasing progesterone. Due to that increased level of progesterone inside the female reproductive tract, it sends a negative feedback to your hypothalamus and anterior pituitary, due to which that decrease in the GnRH secretion, and GnRH secretion decreases, automatically your FSH and LH number decreases, due to which that progesterone and estrogen which is produced by your own body number decreases, and that your uterus become unfavorable to get implanted. Implantation does not occur. Secondly, one thing is also happening here. This is your cervix, okay, and cervix get blocked due to excess mucus production by these things. Okay, these IUDs produces excess mucus here. Your sperm get trapped in this. Okay, the sperms get trapped in this, and that sperm does not go ahead. Okay. Now next. See how this you implant the IUD inside the female body. Okay, this is your uterus. It will implant inside the body. Okay, increase in the number of progesterone. It will go into that your hypothalamus. From hypothalamus, it is going in your pituitary, anterior pituitary. It will inhibit the release of your GnRH. GnRH will come low down from here, and here your that FSH and LH goes down, due to which automatically your progesterone and estrogen goes down. Okay, and it will make a negative feedback system inside your body. Now next is your oral contraceptives. These are the drugs which is taken by the female who thinks get fertilization. Okay, who thinks the coitus is done, the sperm meets with the ovum, and then fertilization happens. Then the females can take these pills. Okay, this is your oral contraceptive methods. Oral administration of progesterone or progesterone estrogen combination in the form of tablet, in the form of pill. Pills are taken daily for 21 days, starting within the first 5 days of menstrual cycle, after a gap of 7 days. It should be repeated in the same pattern till the female desire to prevent conception. Okay. They inhibit the ovulation and implantation and thicken the cervical mucus to prevent the entry of sperm. Pills are very effective with less side effects. See that how this thing happens. So now we are going to see how these contraceptive pills works. Okay. As you know, here we have written 1, 2, 3, 4, 5, but it is not the thing. It is the sequence of that pills. The main thing is that this pill you have to eat on the 5th day. 6th. Pills are taken daily for 21 days, starting with the first 5 days of menstrual cycle, after a gap of 7 days. Okay, these lower side, these 7 things. Okay, these 7 red tablets. These are not related for the hormone. These all are your iron tablets. Okay, they are iron supplements. Previously, the previous packs of these capsule, these strips does not contain these things. There is empty place. Okay, but now due to the menstrual cycle, the blood loss happens simultaneously. Iron loss will happen inside the female body. So that the pharmaceutical companies add tablets of iron. Okay, which help to that make more iron inside the body of the female during the menstrual cycle. Okay, and you see this one. Okay, this one is from Abbott company. Okay, this will show you 21 capsules. Okay, 1, 2, 3, 4, 21 capsules. This is the previous one. Okay, now the new addition in which they give you iron capsules to make and to face that blood loss. Okay, so now that is your Saheli. Okay, it is developed by your Indian government. It is developed by your Central Drug Research Institute in Lucknow. Okay. Four things you have to remember about this drug. That is the main four things which definitely come in NEET exam. First one, this is non-steroidal drug. Okay, it does not control any type of steroid. Second thing, it does not have any side effect. Third thing, it is highly effective. And fourth one, you have to take this thing once a week. Okay, previous one you have to take that thing 21 days regularly, but this one you have to take only once a week. Okay, these are the four things which have been most important related to this drug. Is to you have to take once in a week. Second, it is non-steroidal. Third one, it is having no side effect on the body of female. And fourth one, it is very effective. Okay. So now we will see how this thing will work. Okay. Now it is non-steroidal drug. Haley is non-steroidal drug. How this non-steroidal drug work on the body of female? Now to see that. Okay. We are going to discuss about the functioning of your Saheli drug. Okay. In the Saheli you have one chemical. Okay. In Saheli there is one chemical which is called centromin. Centromin is present inside your Saheli drug. Okay. And it is an anti-estrogen hormone. Anti-estrogen chemical. Okay. Anti-estrogen chemical. It will reduce the release of this hormones like progesterone and estrogen inside the female body. Okay, make your reproductive tract unsuitable for implantation. Okay, that is the basic funda of this drug to work on your body. It contains a chemical which is called centromin. Okay, which is an inhibitor, anti-antagonic chemical. It reduces the secretion of that hormone inside the body of the female. Okay. Now next is your injectable. Okay, injectable IUDs means these IUD you have to inject inside your skin. It comes in the form of patches. You can inject that thing inside the skin subcutaneously, and it releases the hormone slowly inside your body. It releases the hormone slowly inside your body. It applies subdurally. Okay, implant is placed inside inner side of your skin here. Okay, it contains hormones, and these hormones slowly secrete inside your blood. Okay, progesterone estrogen combination are used by females as injections and implant under the skin. Their mode of action is like that pills, and their effective period is much longer. Okay, the action is much longer because the drug is releasing out from your body very slowly. Okay, progesterone and progesterone combination IUDs are used as an emergency contraceptives within the 72 hours of coitus. It avoids pregnancy due to the rape and sexual intercourse. The example is your most commonly used 72-hour pill is your IUD. Okay, it is having high concentration of drug, and it will act as an anti-abortion thing. Okay, it will take 72 hours of the time, and it will cause that pregnancy to abort. Okay, it will destroy the pregnancy to abort. Okay, it will not cause the pregnancy inside the female body. Okay, that anti-pregnancy drug is your mifepristone with misoprostol. Okay, these two are anti-pregnancy drugs or abortion drugs. Okay. Now next is your surgical method of which we call sterilization. Okay, it helps to block gametes transport and thereby prevent conception. It is very effective, but reversibility is poor. Okay, it is very poor. Okay, you cannot make to attach that cutted tissues. Okay, sterilization is of two types. In male it is called vasectomy. In female it is called tubectomy. In vasectomy what we do? We cut vas deferens. Okay, in tubectomy what we do? We cut your fallopian tube. Okay, so this is your cutted fallopian tube which is tied, and this is your vas deferens that is tied and cut. Okay, but there sometimes when questions come in the mind. Okay, or one thing is there that I want to tell you that if a male we recently get tubectomy or that vasectomy, and after that time he want to do sex, he can produce a baby. He's a fertile because that sperm's count does not decrease inside the storage part of that male reproductive system, means in prostate gland. Prostate gland, we store the semen for some time in which the sperm is also present. After 1 to 2 ejaculation, that prostate gland get empty, it does not contain any sperm in the semen, then that person become fully sterile. Okay. See now the side effects of hormone contraceptives. What is the side effects of these contraceptives on the body of female? First, mid-cycling spotting. Okay. Second, reduced sexual drive. The sexual drive inside the female body get reduced. Then headache. Okay, nausea, vomiting like effect come under the female. Vaginal thrush and vaginal yeast infection, fungal infection develop inside the vaginal tract of female. Okay, next mood swings, then breast symptoms. Okay, some drugs can induce breast cancer also inside the female. Okay. Next is your MTP, medicinal termination of pregnancy, which is your also known as abortion. Okay, as abortion, in which you abort the developing embryo from your body. You remove that developing embryo from your body by either surgically or either by that drugs. Okay. So intentionally or voluntary termination of pregnancy before fully term is called MTP or induced abortion. In every year, 45 to 50 million MTP is done worldwide. Okay, MTP has to decrease the population. Okay, it stops your population explosion. Okay, many countries have not legalized MTP due to emotional, ethical, religious, and social issues. But in India, in 1971, MTP is being conducted. It will get legalized MTP in 1971, but under some laws and some circumstances. Okay. Next, importance of MTP. What is the importance of MTP? To avoid unwanted pregnancy due to causal intercourse or failure of contraceptive use while coitus or rapes. Okay, rapes and coitus के दौरान जो contraceptive use होते हैं उनका failure होने के कारण MTP कराया जाता है to do the abortion inside the female. Okay. Second, it is essential in the case where continuation of pregnancy could be harmful to the mother or to the fetus or both. Okay, means your ectopic pregnancy other than uterus, it is very bad for the body of female. Okay, so in that case, abortion is done inside the female body. Okay, next, MTP are safe during the, that is the most important line for need point of view also. MTP are safe during the first trimester or up to the 12th week of pregnancy. Second trimester abortion are very risky. Okay. That first trimester means 12th week of that embryonic development is the best time to do abortion. After that, it is risky to do abortion. The female get some bad effect. The reproductive system damage can happen after that 12 weeks or after one trimester you do that MTP. Okay. So problem related to MTPs is first, majority of MTPs are performed illegally. Okay, illegally means it is not legalized by the government, not under the legal act. It is doing illegally by some doctors. Okay. Misuse of amniosynthesis test for fetal sex determination. If the fetus is female, it is followed by MTP. Such practices are dangerous for young mother and fetus. So what is amniosynthesis? Amniosynthesis is a process in which we take amniotic fluid and determine what is the condition of the developing fetus. Either it is male or female. That is the sex determination part of that thing. The good use of amniosynthesis is to detect your hereditary disorders, metabolic disorders. Okay, but some people misuse this technique and make the female fetus die. Okay. Next, Government of India enacted the Medical Termination of Pregnancy Act in 2017 to reduce illegal abortion and consequent maternal mortality and morbidity. Okay, Indian government started a law and gave a law in 2017 that without permission of government, without taking proper prescription from a well-known doctor, gynecologist, you cannot do abortion. You have to fill many forms to do this abortion. Okay. This is your process of that amniocentesis in which that needle is injected inside the developing fetus and you take the amniotic fluid. You use sonography also that simultaneously time that injection does not get injected inside the developing fetus. Sonography send that sonar type of signals to the baby and it will hit down by that thing and again you can see that thing on side the screens. Next is your sexually transmitted diseases. Okay, diseases transmitted through sexually intercourse are called sexually transmitted diseases, venereal diseases or sexually transmitted infection. Okay, reproductive tract infection is also the name of your STDs. Okay, so some of the common STDs is your AIDS, herpes. Okay, then your genital warts, chlamydia, syphilis, gonorrhea, trichomonasis, hepatitis B, all these are your sexually transmitted diseases in which your gonorrhea, syphilis is caused by your bacterium. Okay, while genital herpes, genital warts, AIDS, hepatitis B is caused by virus and trichomonasis is caused by fungal infection. Okay, now one thing is there is two types of herpes. One is your oral herpes and second one is your genital herpes. Oral herpes is done by your HSV1 type of virus. Okay, see there is two strain of this virus. Genital herpes is caused by a virus which is known as HSV2. Okay, HSV2 is the virus who causes genital herpes. Okay, another herpes is your oral herpes or mouth herpes, which is done by HSV1. Okay. Next is your sexually transmitted diseases. How these things will happen inside the body. First thing is your unprotected sex with infected partners. Sharing needle with infected person by placental route. These viruses, especially your HIV and your hepatitis B virus, they can cross placenta easily and infected blood from the infected person you injected inside your body. Okay. See that gonorrhea is treatable. Syphilis is treatable. Genital herpes is not treatable. Chlamydia is treatable. Genital warts is treatable. Trichomonasis is treatable. But hepatitis B and hepatitis B and HIV is not treatable. Your genital herpes, HIV and hepatitis B, these three are not curable, but your gonorrhea, syphilis, chlamydia, genital warts, trichomonasis is curable. Okay. Next is your what is the symptoms of your these STDs. First, early symptoms: itching, fluid discharge, split pain, swelling, etc. in the genital region. Absence or less significance early symptoms and the social stigma detect the infected person to consult a doctor. Okay, means there is discharge, pain in genital areas, fluidy liquid coming down from the genital areas. There should be warts and pimples like structure develop inside your genital tract or outer genital area. These are the symptoms of that STDs. See in this that vagina get inflated. Okay, your uterus get inflated. Okay, this lead to complications such as pelvic inflammation diseases, abortions, stillbirth, ectopic pregnancies, infertility and cancer of reproductive tract. Even the cancer of reproductive tract, that genital herpes, it causes cancer inside the female. Okay. Now prevention. First, avoid sex with unknown partner and multiple partner. Automatically when you avoid the sex with that multiple partner or unknown partner, that the person you do not know, automatically you get safe from these diseases. Then always use condom during coitus. Okay, condom, that is your barrier method, okay, which will save you from these STDs. Next, in case of doubt, go to the qualified doctor for early detection and get complete treatment. Okay, all the person are vulnerable to STD. These are very high among the person of age of 15 to 24 years. 15 to 24 year age person are highly vulnerable to these diseases because at that time they are sexually active. They do not are not get proper information about the sex, and they get easily caught and they easily get these diseases. That's why this chapter gives you information about all these things to avoid STD to your body. Okay. Now we are going to start with the second part of this chapter, which is your infertility, and we are going to see that how can we abort this infertility inside the body of the female and males who are not having the power to give birth to the newborns. Okay, so first we have to see the definition of infertility. It is the inability to conceive or produce children even after 2 years of unprotected sex cohabitation. Okay, means you are doing sex. Unprotected sex means you are not wearing any physical barrier, any that IUD, any natural method, any drugs, contraceptive pills you are not taking. Even that, after that you are not conceiving pregnancy, you are not getting pregnant, then this thing is called infertility. Infertility can be because of male, because of female, or can be because of both. Okay, it is not in with one sex. It is can be happen in both male and female. Okay. The reason for this may be physical, congenital, disease, drug, immunological, or even psychological. These disorders can be treated by infertility clinics using assisted reproductive technology, which is called ART. Okay, assisted reproductive technology ART can easily treat these diseases. Okay. So this is the classification of your ART. First we have IVF. Okay, in vitro fertilization, then GIF, gamete intrafallopian transfer, then your intracytoplasmic sperm injection, then your artificial insemination and surrogacy. Okay, and I can also draw this thing by a small method, or then easily can tell you that first one is your in vitro fertilization or test tube baby program. In this program, you have two different procedures. First is your zygote intrafallopian transfer, and another one is your intrauterine transfer. Okay. So in this method, ova from a wife and a donor, or from sperm from a husband or donor are collected and are induced to form zygote under simulated condition in the lab. All these things come under lab. Okay. So in lab, you will take male from male sperm, and from female you take ovum and then fertilize them and make a zygote. Okay. Then it is followed by embryon transfer. These both are the techniques of embryonic transfer. Okay. So in zygote intrafallopian transfer, that's if you do what? You take a blastomer which is of 8 cell stage. Again I am saying ZIF is done on a developing blastomer which having 8 cell stage. Okay, you place that 8 cell stage blastomer inside the fallopian tube. Okay, next one is your intrauterine transfer. Transfer of embryo with more than 8 blastomer inside the uterus. You take that embryo which having more than 8 cell stage and put that blastomer inside the uterus, then it is your intrauterine transfer. Again, ZIF happens with 8 cell stage or less than 8 cell stage. An intrauterine transfer is done by more than 8 cell stage. Okay. Embryo formed by in vivo fertilization. Fertilization within the female is also used for such transfer to assist those female who cannot conceive. Okay. Next is your GIF, gamete intrafallopian transfer. In GIF, you are taking a zygote, but in GIF, you are taking a gamete. Okay. Transfer of an ovum from a donor into the fallopian tube of another female who cannot produce ovum but can provide suitable environment for fertilization and development. Okay, a female who does not have the power to do oogenesis. Ovum is not producing inside the body of that female, but that female uterus is favorable to get conceived. So in that condition, you take the thing, okay, that female who cannot produce the ovum, in that female you will put that ovum and fertilization happen, and in uterus that fertilized zygote get implanted and convert into your that embryo and that your fetus. Okay, that is your gift. Okay, see this how you can do this thing. This is catheter which contain the egg, and you transfer that thing inside the fallopian tube of that female. Okay. Next one is your intracytoplasmic sperm injection. It is again a laboratory procedure in which single sperm from male partner is injected directly into the egg. After that fertilization, the embryo is implanted into the female uterus. Okay, see. This is a lab technician doing that for seeing that sperm, counting the sperm, taking the one of the best sperm. Okay. Now he injected that sperm inside the ovum. In ovum, that thing get fertilized. Okay. You see that is a fertilized egg. Okay, and then after that it will convert into your 8 cell, 16 cell, 32 cell stage, and after that you implant that thing inside the female uterus. Okay, next one is your artificial insemination AI technique. Okay, in this technique you will take, you will use, you will take an important male. Okay, this technique is done with the important man whose external genitalia is not functional, or the person who has less amount or less count of sperm, or their sperm is not that much powerful, that much capable to do fertilization. Okay, in which what you do, you will take that semen from outside, from some other donor or some other male, and you put that thing inside the female reproductive tract. Okay, the semen is collected from the husband or a donor, is artificially introduced in the vagina of the uterus of the female. Artificial insemination into the uterus is known as intrauterine insemination. This technique is used for male partner having inability of insemination, means their penis is not erecting properly. Okay, and low sperm count. Okay. Next is your surrogacy. You see Salman children. Some of them are not given birth by body Khan. Okay, it was surrogated. Okay, so see the female who is not able to get the baby inside the body, having that uterus which is unfavorable to give house to a baby, then that female take chance to give that chance to some other female. That female is called surrogate mother. Okay, that is not biological mother. Okay, that is not a biological mother of the developing baby. Okay, so hence a woman surrogate mother bear a child for a couple unable to produce children because the wife is infertile or unable to carry. The surrogate is impregnated through artificial insemination or implantation of embryo produced by IVF. Okay, either you can do this thing by that insemination, artificial insemination process, or by IVF processes. Okay. Now next is problem related to arts. First, it required high precision handling by specialized, professional and expensive instrumentation. Very expensive instruments are used to do this technique. Emotional, religious and social problems are there related to this problem. Some mothers will rent their uterus, okay, ask more money from the parents, from that couples who are infertile. Okay, so these all are ethical issues related to art. Okay, next and last point is that legal adoption is the one of the best method for couples looking for parenthood. Okay, if you do not having that much money, if you are not having the money to go to these all processes, okay, all these art techniques, then you can adopt a child. Okay, adoption is the best option. The parents who do not have the child. Okay, you are giving a home to a person who do not have a home. Okay, the child who do not having the home, you giving that person a home. You are giving a shelter to the home. You giving your name to that child. Okay, so that thing is very good. As a professional view, I am saying that it is a very good thing. Okay, or if you do not want a human child, you can adopt an animal also. Okay, you can pet that animal just like your son or daughter. It is also good for that animal also. Okay, so for today that much, and like, share, subscribe for next video.